Good morning, everyone. I'm Alex, and I've been a student here in the School of Public Health and Health Sciences for quite some time now. I received my bachelor's in nutrition in 2014, my master's in epidemiology this past May, and I'm currently pursuing my doctorate in epidemiology. As a Sharon, Massachusetts native, nearing the end of high school, I was determined to go to college somewhere across the country, preferably somewhere warmer. On a whim, I decided that I would attend an open house just to see what UMass had to offer. During that open house, I was attracted to the variety that UMass offered, both academically and for extracurricula. Even though at that time, I had no idea what I wanted to study, I felt reassured that at a school as diverse and large as UMass, I would have plenty of opportunities to explore any avenue of my choosing. As a member of the cross-country and track and field teams, I started in the School of Public Health and Health Sciences as a nutrition major, initially interested in how nutrition contributes to athletic performance. Not completely sure of how I wanted to translate my nutrition major into a future career, as an upperclassman, I was fortunate enough to have had the opportunity to work as a research assistant on a project examining how food insecurity is related to various adverse health outcomes among Cambodian women in Lowell. My role in that project was to conduct focus groups and to interview each of the women. As I went through each interview, I listened to the women describe their hardships in accessing fresh and healthy foods due to financial barriers, and how these hardships affected their mental and physical health and well-being. After collecting and analyzing some data, we were able to identify that the women describing a lack of accessible healthy food were also the same women reporting being depressed. It was during that experience that I began thinking critically about how food environment affects nutritional status and in turn health risks from a population standpoint. The following semester, I enrolled in an independent study that served as the next stepping stone in the path that led me to epidemiology. This particular independent study involved designing an intervention in the dining halls to reduce the amount of processed meat consumed by the campus community. In order to design the intervention, the other students and I were required to read several epidemiologic studies that investigated the link between processed meat and cancer. As an undergraduate, that was the first time that I had ever read an epidemiologic study, and the moment that everything clicked for me. I remember being completely fascinated that we can explain, at least in part, disease as it relates to nutrition from a population perspective. I remember thinking back to my time in Lowell and realizing for the first time that we can actually quantify the relationships between diet and disease in populations using epidemiologic research. I realized that I didn't want to just read about the studies done by others, but that I wanted to be a part of it for myself, so that I could someday contribute to identifying new risk factors for disease that translate into public health recommendations for healthier communities. After doing a bit of investigating, I realized that I would need at least a master's degree in order to understand the complexities of epidemiologic research. When it came time to apply to graduate programs, I reflected on those unique opportunities presented to me as an undergraduate in the School of Public Health and Health Sciences. I thought about how many faculty members had guided and encouraged my curiosity, and it only made sense that I stay here. Now, as a graduate student in the epidemiology department, my research is focused on nutritional epidemiology as it pertains to women's health. Along with a few other faculty members and students, we're currently conducting research to understand how intake of nutrients such as vitamin D and calcium affect a woman's risk of early onset menopause, which places them at higher risk for osteoporosis, earlier cognitive decline, and other adverse health outcomes. I ultimately hope to continue my research in women's health in an academic setting, using epidemiology to improve the lives of others while also teaching future generations of epidemiologists. In this department, I found exactly what I was looking for when I went on that first campus tour as a high school senior. I found just the right amount of guidance and opportunity to grow from the uncertain undergraduate to the PhD student that I am today.